Hi, I am Dr. Debasish. I am the Senior ENT Head and Neck Consultant of Columbia Asia Hospital, Whitefield. I take care of all the ENT and head and neck problems. One of the very common problems of modern civilization is called sleep apnea, which is affecting millions of people around the world with grave consequences. We tend to ignore it. Basically, one of the common symptoms of sleep apnea is snoring, and people take it more as a social problem than a physical or a body problem. But we should not ignore anyone who is snoring very seriously or very heavily. Now, from the definition of sleep apnea, sleep is sleep. Apnea means breathlessness or cessation or stoppage of your breath for a few seconds. So what is happening when you are sleeping due to some obstruction of your air passage or due to some inability of the breathing center in your brain? Your breathing stops for a few seconds and then it again starts breathing. So this happens not once, not twice, multiple times during your sleep. This condition is called sleep apnea. If it is happening, please don't ignore it, because the consequences of sleep apnea is grave. It may cause severe blood pressure problems. It can cause heart attacks. Sometimes in very untreated and ignored cases, it can even cause brain stroke. So if someone is snoring very heavily, just observe him when he is sleeping, whether he is getting breathless or not. If he is getting breathless, please come and show him to an ENT specialist. We will do a sleep study or a sleep test to confirm the diagnosis of sleep apnea and also to quantify how severe it is, whether it is mild, moderate or severe. And accordingly, if you can take the management of sleep apnea, your longevity will be improved, your lifestyle, your quality of life will definitely improve. Now, there are three types of sleep apnea. The most common is called obstructive sleep apnea. As it is very clear from the definition, it's obstructive. So there is some obstruction of the airway. So the airway of our body starts from nose, it goes through the nose and throat, and it ultimately reaches the lungs. So there may be some obstruction in that particular route. Mostly we see the obstruction is in the nose and the throat, which causes tremendous amount of airway problems, where there is decrease in air coming to your body while you are sleeping, and it causes a significant drop in the oxygen saturation level, which ultimately affects your heart and brain. So obstructive sleep apnea is a very common cause of sleep apnea. It's also seen in people who are overweight or obese. So obese patients with snoring has got a high chance of having sleep apnea. The other type of sleep apnea is called central sleep apnea. Central means it is coming from the brain. So there may be some neurological problem which is interfering with the breathing center in the brain to breathe effectively, as a result of which the patient is getting breathless. For central sleep apnea, you have to show a neurologist. Another is called mixed apnea, where there is a combination of both obstruction and central component. So in such cases, the patients have to be managed by both an ENT specialist and a neurologist. So these are the three common types of sleep apnea. Anyone who is suffering from severe snoring and sleep apnea, please do not ignore the condition. It does have, as I have mentioned, grave consequences. Please come and show your ENT specialist or the neurologist and get it cured permanently.